We start off by welcoming Mr. Bill Wells. He is the Senior Vice President for Business Strategy at the Housing Authority of Baltimore City, which handles Baltimore's public housing. He was initially hired within the executive office to work on issues around strategic planning and organizational overhaul and realignment strategies before taking on the role of Senior Vice President. His portfolio includes coordination of large-scale internal projects and strategic initiatives, governmental relations, working very closely with Baltimore City agencies and elected officials, as well as engaging in outreach and partnerships with external strategic partners. Outside of the Housing Authority, he also serves on the College of Public Affairs Dean's Advisory Committee at the University of Baltimore, and has formerly served in really various leadership capacities with the American Society for Public Administration and other foundations and organizations throughout the city. Prior to joining the Housing Authority, Bill worked as a research manager at the Schaefer Center for Public Policy at the University of Baltimore, which is where I came to meet him, and worked on a large set of different research studies that focused on many things, including some work with the state of Maryland and the city of Baltimore. Prior to these professional realms, he received his Master's of Public Administration at UB and went to UMBC, actually. So he is an alum of UMBC, so very glad to have him. And today he's going to focus his talk on, obviously COVID-19 and sort of the policy surrounding that as it relates to housing and public housing and affordable housing within the context of Baltimore. So without further ado, thank you very much for taking the time, Mr. Wells. Very glad to have you.
Thanks, Eric. It's great to, I guess, sort of be back at UMBC. I did do my undergrad studies at UMBC. I had the honor to work with Dr. Cindy Hody, who is still with the department, and the late Carol Barnaberry. They taught, and I was in their inaugural international negotiation course that the two of them put together quite some time ago. It seems like. I also rode with the crew team at UMBC when I was there, and was privileged to be a coach for the team for many years after I graduated, and was good friends with the late Lou Cantori, also to me a giant of the poli-sci department there at UMBC. That's a little bit of my my UMBC background. I have been at the Housing Authority for about 3 years now, and did government consulting, as Eric had mentioned before that. Wanted to give you just a general idea about the Housing Authority, just to frame the conversation. Eric had talked about the public housing aspect of it, and that's usually what people think of, right, when they think of housing authorities, at least in large urban centers. HABC is one of the 5 largest, I believe, at least by HUD's calculation, housing authorities. And it administers 2 different programs, and that's public housing, traditional public housing developments that people think of when they think of housing assistance, but also and I would say more recent, although it's been decades and decades, Housing Choice Voucher Program, which was an evolution in policy that shifted funding away from running large housing developments in public housing, and sought to try and find a way to get low-income residents housing assistance in the private market through housing assistance payments directly to landlords. So all told, the Housing Authority and those two main programs, serves probably close to 28 or 30,000 households in Baltimore City, either through direct public housing or through a variety of private housing, privately managed housing, redeveloped housing, or through the Housing Choice Voucher Program, which has a capacity of up to about 17,000 households in the various programs. Voucher programs used to be known as Section 8 because they were formed under Section 8, but they're more likely to be known now as Housing Choice Voucher programs because they encompass a variety of different housing subsidies. So HABC was formed in 1937 in the city of Baltimore, and at that point, HUD had decided that they wanted to decentralize housing assistance, and it was the sort of blight elimination and slum clearance. In Baltimore, we had 6 housing developments that came online in the 1940s. And those are old, traditional barracks style, 2- and 3-story sprawling developments. And the Housing Authority grew and then added the voucher program and was always managed directly with the Baltimore City Department of Housing and Community Development, even though they're very different agencies. And the Housing Authority and all public housing authorities are directly federally funded. HABC receives a little over $300 million in annual operating budgets to run voucher and public housing, and then additional allocations for capital improvements and that sort of thing. So public housing authorities are very specific types of agencies. And that split in 2017 under then Mayor Pugh allowed the Housing Authority to really focus on its core mission, which was providing and improving public housing and housing choice voucher program in the city. So that's a little bit of background. And it directly relates to the way the Housing Authority was able to and has been grappling with the COVID-19 crisis. And I say that because the way that the Housing Authority operates is under the Code of Federal Regulations that governs public housing and the voucher program. So when local and state levels of government apply various remedies, whether it's rental assistance or moratoria on evictions and other funding, a lot of that can but doesn't necessarily directly impact a public housing authority. So we look for notices from HUD. What is HUD's guidance to public housing authorities? What additional flexibility or funding would we receive to grapple with this health crisis? And that came through a series of public information or public and Indian housing (PIH) notices, where HUD allowed housing authorities to take advantage of certain waivers. So a waiver is basically a notice that, if we adopt it, allows us to waive certain criteria that we would normally operate under. For HABC, that included pushing out the required deadlines for income recertifications, or allowing landlords and tenants to self-certify in certain situations. And so I'd be happy to go into some of those nuts and bolts more, I guess, if you have individual questions. But I really wanted to highlight some of the other impacts. We're an organization of over 620 employees, and serving particularly the housing developments it's a personal interaction, right? We run developments with maintenance staff. We run developments that have person-to-person interactions with residents coming in and asking for assistance or putting in maintenance requests or doing recertifications for income and that sort of thing. That's difficult in an environment where you are not supposed to be meeting people face to face. If you cast your mind back to March, we were all working in offices, either in a municipal building or at a housing development or at our main leasing and admissions office. And a lot of that was direct person-to-person contact. And so in March of this year, we pulled back really hard on what we did. We looked at what do we absolutely have to do and what can we push and still provide decent, safe, and sanitary housing, but keep our employees safe and keep our residents safe. One of the first things we did was to send everybody home. Now, that may be a little different, I think, when we're looking at students, from your perspective, possibly, where you've got a very mobile environment anyway, even though a lot of your courses may have had in-person lecture components in the past, there's an element of adaptability there. Now think of an agency where the majority of the work that you do is in an office, in someone's unit, in a maintenance facility, or with hardware that can't be moved around, right? So I'm speaking to you from a laptop computer in my living room. Before, I had a desktop computer, and it was essentially chained to my desk on the 13th floor of our building. And so we immediately had to grapple with, how do we send everybody home and still provide service? How do we get VPNs? How do we get 800 numbers, right? So first we went to 1 million teleconference numbers. And then we figured out how to use Zoom. And then we figured out that Zoom is not secure. and HUD came out and said, well, be careful, because if you get Zoom bombed with while you're discussing protected information of residents, that opens you to liability. So very quickly grappling with an ever-changing landscape. What's safe? How close can you be to people? What constitutes symptoms? And ultimately, how do we serve residents when either it's not safe, we don't know if it's safe, or residents just don't want us coming to their units at all? So those were the big, I guess, questions, the big things we needed to immediately grapple with as an agency. And as you can imagine, being students of policy and government, agencies don't turn on a dime, right? The federal government, which has had a robust telework program, even had difficulty contemplating how to do this. We're an agency that didn't have a formal telework program, so we had to figure out, not only from a nuts and bolts standpoint, who can we send home and how can we make payroll? How can we process millions of dollars in housing assistance payments to landlords so that people continue to get their housing subsidies? How can we take information from residents to keep their assistance going, to keep their housing going? And then ultimately, how do we grapple with the downturn in the economy? Now, public housing authorities serve the lowest income residents in any city. Our average income across all of our programs is just over $14,000 a year. Now, that's income from all sources. That might be unemployment, that might be earned wages, that might be disability or any other kind of assistance. That's an incredibly small amount of money to then try and operate a household. In some ways, the housing authority is a model, I think, for a positive outcome in regards to housing stability at this point. We hear about there being, somewhere around $300 million in the state of Maryland in potentially in a shortfall in rent. Well, the housing authority is in an interesting position because we can take our rents to zero if we need to. So, for instance, somebody who is paying a maximum of 30% of their income capped for their housing, if they have a loss of income, they can at any time come in and say, with whatever documentation they have, I lost my job. My income is now zero, and we can reduce their rent. So effectively keep their housing stability, even while their income stability may be going down. That's true on the voucher program too. In that case, we're dealing with landlords, and we're making up what the renter can't pay in terms of the rent for that unit. And the same thing for the voucher program, the resident just has to come in and say, or as we figured out how to do, certify electronically or in video conference, I lost my income. My income went down. We can immediately take their income down and yet increase our portion of their assistance payment. So their landlord is still getting rent. Their landlord can still operate that unit, and we can keep them housed. So we saw a lot of a lot of residents and voucher holders taking advantage of that. It allowed us to keep people housed. And we also discovered that our rent receipts are not lagging the way that a lot of the market rate or the general market environment is, which probably has something to do with the fact that so many of our residents are receiving other sorts of assistance as part of their income. So that's fixed, but it still represents an amount of stability in the time of COVID. I guess there was, I'm trying to think about what the other things were. There was in March a group with the Baltimore City Department of Planning stood up a working group to look at food security. Right. So in March, we're looking at this cliff, and we know it's going to be a cliff. We just don't know how deep the chasm is going to be on the other side. Right. So the food security and food policy folks are now just absolutely in overdrive. Right. We're looking at people not being able to get around. We're looking at the most vulnerable people who are usually also, coincidentally, some of the most food insecure now having less access to food, and more, not even less access, but remember just the heightened fears of what could be coming led to a run on everything. So the housing authority, because we pulled back a lot of those frontline staff from their day-to-day operations, and by the way, laid off no staff. One of the other advantages to being federally funded is that our funding goes along with the services we provide. Well, we were still providing those services. So we did not see the same sort of reduction in funding. Now that may happen with additional federal budget cycles, but whereas state and local governments, because they're relying on tax revenues and they see those tax revenues go down, they've got to pull back on operational funding. The same wasn't true of the Housing Authority. So we could shift some of those staff. We worked with the Maryland Food Bank, groups of food providers, and the Maryland National Guard to deliver over 300,000 pounds of emergency food across 20 family and privately managed low-income housing sites over about 2 months. And that was into the summer of this past summer, really in that heightened period where people either couldn't find all the resources, or they couldn't find them in the same places that they used to, or they were scarce. A lot of empty shelves, a lot of stuff that was either price gouging or hoarding and that kind of thing. And again, with a low-income population that is food insecure at a lot of the rest of the year anyway. One other point about food security, we also used to operate a series of high-rise elderly and non-elderly disabled low-income buildings. And we don't directly operate those buildings anymore, but we have oversight and asset management relationships with those buildings. We were able to work with Meals on Wheels, the state of Maryland, and again, this food policy group at the city to provide anywhere from 2,000 to 4,000 meals per day in these elderly and disabled buildings. And there's about 18 different buildings throughout the city. Now, imagine, folks who have difficulty with food resources to begin with, but now imagine that they are the most vulnerable populations, predominantly African American, lots of comorbidities in terms of other health problems, a lot of asthma, and they're in close proximity. They're in a high-rise housing situation. You don't want people in that situation going out, right? You don't want them congregating in public places. You don't want them having to take public transportation to get to the store. So we figured out ways to partner with all of these groups to provide meals and nutritious meals on a consistent basis, so that people didn't have to come outside and risk exposure. None of that is in the purview of the Housing Authority, right? So we're a housing organization. And our pitch to the Guard and the state of Maryland and anybody who would listen was, we don't have the resources to provide food, but we know where all the low-income food insecure folks are that we interact with on a daily basis, and we can help you reach them. And then it was just a matter of coming up with a safe way to do that. Lastly, we most recently have started to partner with the Maryland Department of the Environment on wastewater sampling. So they've piloted this at a couple places, Mount St. Mary's, I believe, in Emmitsburg, and coincidentally, though not in the same area, St. Mary's County on the other side of the state, where they would take just a sample of wastewater, sewer water, and test it for COVID or for SARS-CoV-2. And what they're able to do is pinpoint, where do we see a rising level of virus in wastewater? And that points them toward where there might be a concentration of community spread or circulation. And then they can target resources, either go in and do a lot of testing or amp up their public affairs and PR campaigns, and really put a spotlight on a specific geographic area. So MDE came to the Housing Authority and said, prioritize the buildings, either those high-rise senior buildings or our family developments, for where you'd like us to do sampling. And they have a grant, and we're going to work with them so that the sampling can be done. It's anonymous, right? So it's not testing a person. It's not breaching any sort of protocol, but it allows them to test and discover whether there are increasing signs of virus circulating. When you're talking about public housing, again, you're talking about areas where, because of the legacy of the way we've done public housing in the United States and in Baltimore, you're dealing with concentrations of low income. In Baltimore, it's predominantly African American, and usually all of the things that tick boxes for poor outcomes when it comes to COVID. So we're really excited about the opportunity to possibly get ahead as we see cases starting to rise, get ahead of that wave in relation to the sites we manage. So that was a lot of talking about a lot of different things, and I guess I wanted to ask Eric. There's so many different ways, either just internal policy, talking about HR and employees, talking about HUD and policies that govern the agency as a whole, and then just sort of operations and relations with other agencies and outside organizations. So I don't know if you or your students have any particular way that you'd like to go for the rest of the hour. I'm actually way more comfortable hearing the things that would be of interest to you all than just finding the things that I think are interesting.
Great. Well, thank you so much. And so I think that is great. And what I will do is, I'll sort of lead us off with a question and a couple comments, and then we'll open it up and see sort of what everyone is interested in. So, start thinking about questions that you might have given what you've heard. What I think is particularly fascinating is several things. I mean, we have had some speakers talk about kind of the intergovernmental dimensions of not so much the response, but the political relationship and the decision-making centers at different levels of government. What I think is some might be interested in sort of picking up on that dimension. What I think is particularly interesting from my vantage point in listening to you is the way in which within the housing authority, you've been able to redirect resources. And, one of the things we certainly think about when we think about intergovernmental relations and the fact that, the federal government, in this case, HUD, is providing some of the funds that are going to be used at the local level. We often think about all the regulations, which obviously still exist, but the regulations that determine what you can and cannot do as an organization, how you can use those resources and not use those resources. You obviously mentioned waivers, but pretty fascinating to think about how you've been able to kind of redirect resources and address other issues like food insecurity. This wastewater treatment, I'd love to pick up on that as well later. In thinking about going forward, right? And obviously COVID-19, even if, we get a vaccine and address the public health concern, of course, there's longer term policy implications that I think many of us are worried about on the finance side. I would certainly be worried about evictions going forward, housing stability. Is there, if you had to make a decision, right, as to what would be best from either one level of government or, each level of government, whether it be the city, the state, or the federal government, what would be most beneficial for your organization going forward? Would it be more resources? Would it be more regulatory flexibility? Does it sort of vary? Like what do you think would be most helpful for residents, obviously you're serving lower income individuals within the community that would really help these residents sort of going forward? And I'll kind of stop there. I've obviously, thrown some things at you. And then others, please think about some questions that you might have as well.
Thanks, Eric. Yeah, let me touch on those sort of three things that are related that you brought up that I heard, and start with the first one, which was the intergovernmental sort of political dimension. Interestingly enough, as I was talking early on, I may not have highlighted this enough, but the Housing Authority, although it sounds like a city agency, is not a city agency, right? So our leader, the woman I work for, Janet Abrahams, she's the president and CEO of the Housing Authority. She's overseen by a board of commissioners. Those commissioners are appointed by the mayor, and they serve, staggered terms. However, our budget comes from HUD. And so we're responsible sort of financially and programmatically to follow HUD and federal guidance. That's important in a political environment because we also exist within the city, right? So, and as many of you may be aware, there's been some political instability in Baltimore recently. And that leads to a lot of agencies being unsure. In the Housing Authority's situation, we have a sort of a clarity that those other politically affiliated executive agencies don't have, because while we work with all of those agencies, DOT, DPW, Housing and Community Development, and then the counterparts for some of them at the state level, we don't depend on them or the budget process within the city for our funding, or for the city charter doesn't specify how we operate, for instance. So that flexibility is really nice. It does, in this environment, get us in some interesting situations. I'll go, one of my areas is intergovernmental relations. So I'll prepare and give testimony to the city council on a variety of issues. And so, a council member wants to know, well, what's going on with sanitizing buildings? And they're specifically looking at those high-rise senior buildings, and we've got some of those, or we have a relationship with them, and so we get to go in and talk about, well, these are the protocols that are in place. Here's how we're cleaning. Here's how we're restricting access to the buildings, and there's a political dimension to that, right? Because the council persons, they're responding to their constituents, right? So I've got a constituent, and the constituent's coming to me and saying, my granddaughter usually lives with me, and she went off to college and her college closed, and now she's coming back, and they're saying she can't come in and stay with me. Well, granddaughter's not on the lease, so she's not an authorized occupant of that unit. But at the same time, that unit exists in a senior and non-elderly disabled building. And HUD said, you may restrict access to this building to residents and caregivers only, in an effort to get ahead of virus transmission. So we have to walk that line. Here we got an irate council person, right? Why won't you let a family member into this building? Well, we don't play by the city's rules. In that case, we play by HUD's rules, and we take the most conservative approach to safeguard staff and residents. And so everything from that to, there have been bills in Baltimore City for not increasing rent, right? Where they specifically name the Housing Authority. And so we've got to go and ask to be removed from the bill. Look, we don't fall under your purview. And by the way, anybody can reduce their rent. Anybody's rent can be reduced if their income is reduced. The only time we increase rent is at the time of lease signing or if you have an increase in income. So the point's kind of moot because we're not going to be raising rent on people who are losing their income. De facto, we will be reducing their rent. So there are interesting dimensions there as you navigate that, and the state moratorium on evictions and the city moratorium on evictions, and now the CDC moratorium on evictions. All of that is difficult for an agency that has to play by, all of those rules. But ultimately, if they're federal rules, they supersede the local rules. So it's interesting, and again, you have to explain that to people who are used to being, the big fish in the pond. That, well, on a national scale, not so much. So that sort of leads me into your third question. What would be most helpful going forward? We've received CARES Act funding through HUD, and we've received flexibility through HUD. Going forward, more of that would be helpful, but more than anything else would be certainty. So a lot of these waivers, they were supposed to expire in the fall. They've been extended to the end of the year. Well, it's getting to be the, third trimester of November. We're almost into December. At some point, Congress is going to need to, push to extend different things as the what we had hoped would be a crest and then a tailing off, but is now turning into a larger surge of virus. We're going to need to keep these in place, and it's hard to plan for that. It's hard to know what we're going to be able to do if we're looking at needing to pull back to a certain place or need to expend funding, right? So you've got all these folks who are looking at this deadline for spending their CARES Act funding. And it's like, crud. We know that the smart thing would be to extend the deadline, so we don't want to go out and stockpile stuff. That wouldn't be the most efficient use of the CARES funds. We'd like to go out and spend that money directly on residents. We've put together sort of care packages, health safety cards, and face coverings and hand sanitizer and all kinds of stuff like that. Well, we'd like to be able to do more of that, but we have no idea for how long or whether additional funding is going to come with that additional time. So that certainty. And again, in a fraught political environment, it's not clear how we'll have to adapt again in another month and a half. So that's a hard position to be in. Reprogramming resources within HABC, there are a variety of things we were able to do in an emergency capacity. We discovered a year and a half ago, after we had a crisis at one of our developments, that we needed essentially an emergency spending authorization. Should the board or the agency head declare an emergency, that would loosen certain procurement rules that would allow us to do certain things in a more agile way during that state of emergency. We've been able to do that, piggybacking on the city and the state's declared emergencies and executive orders. But we've also been able to reimagine how we do our work. whether we need to be in the office all the time. An anecdotal way of doing that early on, or of explaining that early on, I'm talking to somebody in our finance department, and I mean, she's beside herself. Probably a 20-30 year employee of the housing authority. She has one way that she knows how to do things, and she does it really well. But now that's turned up on its head, right? So she's trying to work from home. And they've given her a laptop to do her processing and her work from home. But her whole workflow is built around having a computer, a printer, and a scanner, right? So I have to receive something, I have to print it out, I have to do calculations and check the calculations in whatever I've been given. I need to sign it. I then need to scan it and send it on to the next place that it needs to go. And she's just having a breakdown because she can't, they're not giving her a scanner at home. They're not giving her a printer. She has to have these things to do her job. Well, employee, have you thought about the fact that you could do all of that just in email? What do you mean? Take that spreadsheet, write your notes into that spreadsheet, save it as a PDF, attach it to an email. Now you've got that entire trail that you did by hand, you've got it electronically. On some larger scales, it's, investing in I can't remember the name of the solution we procured. It wasn't DocuSign, but a DocuSign or secure signing, so that we don't have to have as many in-person or live signatures. Changing the way we procure IT resources so that people can access our secure systems remotely. Do we have just one way of doing that, or do we have multiple ways of doing that, depending on the level of access you need? Deciding that as we go through replacement cycles for computers, that we really should, given advances in computing power and the fact that almost all of our stuff is cloud hosted, we should be investing in high quality laptops and docking stations instead of towers and desktop computers. Because I can work on the computer that I'm talking to you all on just as well in my living room, and then I can put it in my bag. If I need to be in the office, I can take it into the office. And so we have that flexibility. So there's a lot of that I think is here to stay. And there's a lot that our agency and others are probably reluctant, or would have been reluctant, to even examine. What's the cost benefit? What's the risk versus reward to doing a large culture change like that? Well, we got pushed into it, as did a lot of companies and organizations. And I think some of the things that we're learning about how to do that are here to stay. What we haven't grappled with are probably the mental health aspects of that, right? So this is my living room. It's also my office. So I get up in the morning and I walk into my office. I don't have that separation anymore. And with all of the other health impacts of COVID and isolation and all sorts of other things, that's something that I think we're only just starting to get our hands around, but that would be helpful to look at in the future, not just for us.
Great. Yeah, thank you. So it sounds like a lot more consistency, and then potential resources to be able to redirect those. So let me go ahead and open it up to others. What kind of questions might you have for Mr. Wells? And never fear, as I wait for questions, I always have some on the ready, but I want to give other people an opportunity. I'm sure there's a lot of questions around housing and issues centered on inequality and questions regarding evictions going forward. But I want to just kind of give others a chance to weigh in and ask any questions they may have.
Hi, thanks for joining us, Mr. Wells, and welcome back. Welcome back to UMBC. I am curious about people who are recipients of housing authority dollars or live in a housing authority building. When this all started, did they feel like, how was that initial process of conversation with people? How did people know when to reach out or who to reach out to? That's kind of the two big headings of my question, I guess.
Eric, I don't know how you're set up here. If I share my screen, is that disruptive? Okay. So
yeah, I give you full privileges. So you should.
Okay. All right. So I wanted to, in thinking about that ahead of time, I wanted to share with you our website. Now, we immediately in March thought about a lot of those things, and I'm sorry, now the window's small. I think that was Quinlan who had asked. Okay. So all of a sudden, we're going into complete lockdown. So for our offices and our employees, how do we tell the people who are receiving services from us that there are these drastic changes? So we set up, and the reason I go to the website is not because that was the only way of providing information, but because all of our information is here. And if I go down, so we started this sort of running calendar of updates. And a lot of the updates early on were posted to the website as a general announcement, but were actually hand delivered and posted as large posters at our management offices. So, when we started, let's see, when we started to close our offices down in March, every resident household, whether it was voucher or at one of our developments, got a letter, and it said, we are not staffing our offices full time. We are not open for walk-in appointments. Here are the things that you need to do to be able to continue to get services. So for instance, and I thought this would be an easy way to do it. I guess it was longer ago than I thought. We've been doing a lot, it seems like. So stay at home, staff memo, and then how we will coordinate with residents about how they can still get services. Okay, so talking about the closing of our services and our offices, all of this, it exists on this website, but all of it also was directly communicated to residents. We had to stand up phone numbers, right? So if I'm used to going into an office and asking for some kind of, hold on a second, I'm trying to stop sharing now. There it is. If I'm used to going into my housing office, I'm at Latrobe Homes, and I just walk down to the management office and I give the maintenance clerk the information for the maintenance request for my unit. How do I do that now? So we have to, let people know there are all those staff are available in one way or another. We just have to let you know, how do you access that help? And as things were changing, trying to push things out, we've tried standing up text messaging. Although with the population that we serve, there's a lot of instability in telephone numbers or minutes and money on their cell phones to receive messages and that kind of thing. So it's really been a broad approach, everything from social media to web to things posted at developments to U.S. mail to hand-delivered notifications about changes in policy and procedure, but also additional resources, letting people know when a food service van from DHCD would be coming to provide meals, or how people could find out and stay connected to schools, all that sort of thing. Sorry, there were some comments I wanted to see.
Yeah, so there was one question regarding how, what is sort of happening with the housing market as a response. And there's one other one that came in to me as well, individually, which is regarding undocumented immigrants, one of the more vulnerable populations that still contribute to taxes, how they're being supported by the Housing Authority, and also whether your agency will be involved in the distribution of the vaccine.
That's it. I'll take those in reverse order. We're not currently in conversations about distribution of vaccine. I think as I mentioned before, our asset is that we know where the populations we serve, we know where they live, because we're providing services. We don't have a lot of either expertise or resources outside of that. So we do a lot of service coordination and a lot of partnering. If MDE wants to do wastewater testing, we have large populations that are at risk. We would be willing and happy to partner. Same with food, same with vaccine, although we don't have any infrastructure to be able to provide that. I'm sure that when they get down in the levels of distribution to general public, that we will be advocating for distribution at our community centers, for instance, that kind of thing as a point of service, much like we did with the food program. I'm trying to think back to the other things that you were saying, Eric. So it was vaccine and
how undocumented immigrants are supported, and housing tenure turnover. Sort of.
Gotcha. So the undocumented families are problematic for public housing authorities because of the federal funding. So there have also been changes within the current administration at HUD to try and tighten the rules, where a family that would otherwise be eligible if they have undocumented family members as part of the household could lose their eligibility. So, this mixed documentation household, that hasn't been a huge issue in Baltimore City from the public housing standpoint and from the HCVP standpoint, because that's not the majority of the population that we serve, which is not to say that we don't have anyone that would fall into those categories. It's just not the predominant population for us. So we haven't had a lot of impact from those changes, other than policy and procedures that come from HUD. And then advocacy, where we can say this is what the proposed regulations that HUD is thinking about. This is the impact of those regulations. within Baltimore. As it relates to home buyers and people looking for apartments, we deal with a very constrained list. So our waiting lists are, for instance, predominantly closed right now because they're so large. The need for low-income housing is much greater than the supply in Baltimore City. So, we haven't seen the need be impacted by the pandemic. We have seen people, an increase in people abandoning units, not wanting to, for instance, stay in such close proximity, and in choosing instead to leave their unit and go stay with family members, and abandon their unit. So there's been an uptick in that, but it's hard to say more broadly in the rental market. The market is very different. The private market is very different than the market we serve. And I would say the same thing for home buyers. That would be more on the DHCD side, although, I understand anecdotally that the housing market is pretty strong in the Baltimore area. So I'm not sure, how well I can talk about Joshua's question, because it really overlaps out into areas that HABC doesn't encompass.
Yeah, and thanks for that question, Joshua. As Mr. Wells is alluding to, my speculation would be it's going to depend a lot on the particular urban context, and if it's anything, like the Great Recession, though that obviously was specifically in a lot of ways tied to the housing market in a way that this isn't. It could take some time, before we see what the overall fallout is. Yeah.
So, Eric, I was just going to point out, as, say, somebody with an MA in economics might have thought of, there's some trailing factors, I think, that are going to disproportionately impact the population, right? So lower wage workers and workers in industries that are harder hit are going to see huge impacts to income. If we don't see sort of renewal of some of the unemployment and other benefits, and maybe expansion of them, depending on how hard hospitality and entertainment and other industries are hit, that could lead to a huge disparity in what that impact is. So we might see, with a protracted pandemic, that people who are income secure are really well positioned to take advantage of a buyer's market. But I think it'll be differentiated. You're not going to see that same kind of flexibility and robust market when you're looking at lower income, or when you're looking by particular employment sectors. But that's my back of the envelope, read of that.
Yeah, that certainly sounds reasonable. So, well, we are right at 1:00, so I definitely want to, thank you very much for taking the time, and please join me in thanking Mr. Wells for being here. Really appreciate you sharing the perspective of the Housing Authority, and getting into some of the specifics. At some point, I want to talk to you about the wastewater treatment stuff. It's really fascinating. So thank you very much for taking the time. Next week, we will have the president and CEO of Leading Age Maryland, Ellison Zaborowski, to talk about implications specifically for the elderly, and in particular in terms of nursing home facilities. So look forward to seeing you there. And then if you're a student in my class, I'll see you later today. We have our meeting at 2:30. So thank you very much, and glad to have an alum come back and join us.
was great. And, if your class has other questions or they were, more reticent about talking, please just send them over. I'll be happy to answer whatever I can as discussion continues with your class.
Well, thank you very much. Definitely appreciate that. Have a good rest of the day, and thank you for the work you do.
Thanks, Eric.
Thank you.